Hello, my name is Shelley Smith, and I am the Patient Care Coordinator at the Hair Loss Clinic of Colorado. I would like to take a few minutes to introduce you to our surgeon, Dr. James Swinehart. Dr. Swinehart is a board-certified dermatologist and dermatologic surgeon. He is a past president of the Colorado Dermatology Society and founder of the Colorado Society for Dermatologic Surgery. On a regular basis, Dr. Swinehart performs sessions of 300 to over 1,100 micrographs. He is a recent author of the Color Atlas of Hair Restoration Surgery, has written over 29 scientific articles, 2 textbook chapters, and given over 25 presentations both nationally and internationally. Please feel free to contact our center if you would like to receive a list of articles or a brochure on the state-of-the-art technique. As your patient care coordinator, I will assist you with your consultation as well as with scheduling your hair restoration procedure. Now here is Dr. James Swinehart.
Hello, I'm Dr. James Swinehart, Chief Dermatologic Surgeon at the Hair Loss Clinic of Colorado. Today we're going to show you the advantages of the hair restoration skills offered at our center. First of all, we never lose sight of the fact that you're the reason that we're here, and we're here to help you. Your hair and the way you perceive yourself are extremely important. You mow your lawn, wash your car, dress well, and take pride in your appearance. And you should be proud of the fact that you take a pride in your appearance with respect to your hair loss. A recent survey revealed that 92% of men experiencing hair loss were unhappy about their baldness. You've probably heard about scalp flaps, scalp reduction, scalp lifts, and scalp extenders, mini grafts and micrographs. You're concerned about the surgery, and now you ask, which of these would benefit me the most? Which one is best for me? Am I even a candidate? And, most importantly, how natural will it look? What is the state of the art in hair restoration surgery today? Extensive micrografting has revolutionized our approach to many forms of hair loss. With these mega sessions, hundreds or even thousands of tiny hair-bearing grafts containing only 1, 2, 3, or 4 hairs are meticulously inserted, sometimes only 2 to 3 millimeters apart, utilizing dense packing over the entirety of your bald and thinning areas. These micrografts, which approximate the 1 to 3 hairs that naturally originate from each of your own hair follicles, can create a very natural aesthetic appearance. Randomly spaced single hair micrografts can create a very pleasing aesthetic feathered hairline. Scalp lifts, or scalp reductions utilizing 1 or more scalp extenders, can be used to remove larger bald areas in the crown of your scalp. In contrast, older methods utilizing mini grafts, which contain 5 to 8 hairs per graft, or round plugs containing 9 or more hairs per graft, nearly all resulted in a very pluggy or Barbie doll or unpleasant hairline. Indeed, approximately 1 out of 4 cases at our hair restoration surgery center involves a repair or hairline camouflage of these mini grafts or plugs placed at other clinics. For example, here we can see a transition over 4 sessions from frontal baldness to a full head of hair. So we end up with 3 dots. We then go ahead and attempt to connect these dots to create a hairline. So let's just put some marks here, and this will be the area that gets the micrographs. Again, in the back zone, this will be feathered somewhat, but I think here's the zone that we're going to try to graft. We're going to identify an area starting about here, right over the ear, and then we are going to bring that down posteriorly to an area down here. Now, if we try to stay below a line drawn between the top of the ears, if you do that, men very seldom bald down that far. See the nice angle of the hair follicles there? They're perfectly aligned with the razor blade as we made this little loaf, and we're going to continue sectioning the strip until we have 70, 80, 90 of these little loaves, 1 to 1.5 millimeters in width. Now let's see if we can take a single hair micrograph. Here's one with just one hair. Actually, here's a nice two-hair graft, and we just do this with an iris scissors. And you kind of get that in your sights. See that there is a nice two-hair micrograft. We'll take another single-hair micrograft with the iris scissors. Here's a little group of three hairs, so you can see about the size of a three-hair micrograph, the three hair follicles in there. Now we're going to show you the technique of sectioning these micrographs with a very sharp number 10 blade. We're going to section these and take little grafts with maybe 3 to 4 hairs, and this would make a nice single hair graft, but we want 3 to 4 hair micrographs. What we have here, we have single hair grafts, 2 hair grafts, 3 hair grafts, and 4 hair grafts. Over here we have the ones to be used for hair follicle cloning. They're the single hair grafts that are transversely sectioned. Up here we have deepithelialized 3 hair grafts. These have the epithelium on them. Here's a little block of tissue to be used for strictly single hair grafting, and over here, of course, is the bulk of the dissected lobes from the long strip. We have lined up the micrographs on the index finger, and then you can come along and just grab the fat below the hair follicle with this jeweler's forceps, and then we insert this graft and then tease it down, and see it stays perfectly in the hole. Now we're inserting the 3 hair micrographs in the areas where we've had 3 hair microdilators. We've already put in 2 hair grafts for the posterior hairline. This patient, aged 21, with a strong family history of premature hair loss, was able to prevent baldness with 3 well-timed transplants. The grafts were placed in between his existing hairs, preserving the hair that he normally had. This executive, in his mid-50s, has a new head of hair following 3 scalp lifts and 4 anterior hair transplants. This type of baldness, with an intact hairline but with hair loss on top, is seen in both men and women. This fill-in procedure, which works equally well in male and female patients, considerably increased the density on the crown after only 2 sessions. This patient, whose hairline was lowered to its original position, demonstrates the need for hundreds of single hair micrografts in patients with coarse, dark hair. This advertising executive in his 30s was able to turn the clock back with scalp lifts on his crown and 4 extensive micrografting procedures in front. This patient had received some large plugs on his left side some 20 years ago. These are no longer detectable following a repair procedure combined with frontal micrografting. This patient in his late 20s posed a difficult challenge, the subtle lowering of his frontal hairline. His result, however, demonstrates a beautiful result obtainable today. Following the placement of several hundred single and double hair micrografts, he has achieved an undetectable natural hairline with our state-of-the-art techniques. Why choose our clinic for your hair restoration surgery? I'm a perfectionist. I take pride in my work and perform each procedure with the same skill, care, and patience that I would wish to receive for myself or for my own family. Our staff is highly trained and experienced, with registered nurses available for the operating room. During your consultation, my staff and I will provide you with an individual, personalized, and confidential opinion concerning the various therapies available for your particular form of hair loss. When we meet, I will suggest the procedure that I feel might benefit you the most, or if I feel that you're not a candidate for my skills, I will suggest other options. I would like to emphasize that you should undergo hair restoration surgery for yourself out of pride in your own personal appearance. The field of hair restoration surgery has made great strides over the past few years, making aesthetic, pleasing results obtainable by many patients. Future advancements will certainly be made in the years to come. However, today's state-of-the-art procedures can make cosmetic hair replacement an obtainable goal for nearly every patient experiencing hair loss. Therefore, you have only one final question to answer. Do you want to be bald, or would you like to have hair? Therefore, In order to schedule a consultation, please call the Hair Loss Clinic of Colorado at 303-744-1202. Thank you.